Welcome to MBLEx exam practice test. Our topic today is client assessment, reassessment, and treatment. Use the link in the description to download the app on the App Store for free practice tests. Number 1. A client with kyphotic posture would display which of the following? A. Medially rotated shoulders, with the head protruding past the mid-sagittal line. B. A swayback. C. Hyperextension of the knees. D. Drop foot. The answer is A. Medially rotated shoulders, with the head protruding past the mid-sagittal line. Explanation. Kyphosis, or rounding of the shoulders, often results from long hours spent hunched over a computer. It primarily comprises the SCM in the anterior neck, the erector spinae muscles running alongside the spine, the rhomboids, and the pectorals. Swayback, more formally known as lordosis, refers to an anteriorly tilted pelvis that causes the gluteal muscles to protrude, contracting the lower back and weakening the hamstrings and abdominals. Knee hyperextension is often related to lordosis, while drop foot can be caused by tight hip abductors and dorsal extensors, compromising the sciatic and peroneal nerves. Number 2. Gait assessment can indicate which of the following? A. Inadequate hydration. B. The presence of adhesions. C. Muscle imbalance resulting from misaligned posture. D. Factors that contraindicate massage. The answer is C. Muscle imbalance resulting from misaligned posture. Explanation. Poor posture weakens certain muscle groups and forces others to compensate, often becoming hypertonic and resulting in decreased range of motion. Systemic muscle imbalance can result in an uneven gait. Number 3. Brugers relief position is a self-care exercise that alleviates what condition? A. Lordosis. B. Hypertonic at bands. C. Antalgic gait. D. Kyphosis. The answer is D. Kyphosis. Explanation. Brugers relief position helps correct the forward head posture and medial rotation of the shoulders associated with kyphosis. Number 4. If a massage therapist suspects a client is intoxicated, what should he or she do? A. Proceed with the session, using light touch only. B. Consult his or supervisor because intoxication is an absolute contraindication. C. Ask them if they have recently consumed alcohol. D. Proceed with the session as he or she would otherwise. The answer is B. Consult his or supervisor because intoxication is an absolute contraindication. Explanation. High levels of intoxication can affect blood pressure and result in arrhythmia. Because massage therapy increases circulation, it can also dangerously magnify the effects of alcohol and drugs. If a massage therapist suspects a client is under the influence, he or she should contact the supervisor. Number 5. A weak or misfiring gluteus medius can result in which of the following gait deviations? A. Trendelenburg's gait. B. Arthrogenic gait. C. Ataxic gait. D. Psotic limp gait. The answer is A. Trendelenburg's gait. Explanation. When the gluteus medius is not functioning properly, it can cause displacement of the hip during stance phase, when that side of the body is supporting weight. This is known as Trendelenburg's sign. Arthritis is usually responsible for an arthrogenic gait, in which the hip is elevated to allow the toes to clear the ground. An ataxic or stumbling gait may indicate neurological problems or intoxication, which is a general contraindication to massage. Spasm in the psoas, responsible for hip flexion, can cause someone to appear bent at the waist and to demonstrate a psotic limp. Number 6. Which of the following should ideally not be induced by massage? A. Cortisol release. B. Flatulence. C. Sleep. D. A parasympathetic state. The answer is A. Cortisol release. Explanation. Cortisol is a stress hormone released by the adrenal glands when the body is in the fight or flight response. Massage ideally induces a parasympathetic or relaxed state in which the body can better attend to basic autonomic functions. The parasympathetic nervous system is responsible for digestion, breathing and heart rate, all of which are compromised by stress. Number 7. Which of the following is true regarding the connective tissue enclosing muscles and other organs? A. It is called fascia and can be released via myofascial stretching and skin rolling. B. It is called the protective sheath and can be released using muscle energy technique. C. It is called the pericardium and can be released with transverse friction. D. It is called interstitial tissue and can be released with lymphatic drainage. The answer is A. It is called fascia and can be released via myofascial stretching and skin rolling. Explanation. Fascia is fibrous connective tissue that envelops muscles and other organs. Like muscle fibers, fascia can become adhered and constricted at the site of injury or strain. Myofascial release and skin rolling help restore length and pliability to fascia. The other answers are invalid. Number 8. Positive rest position primarily targets which muscle group? A. Hamstrings. B. Hip flexors. C. Quadratus lumborum. D. Erector spinae. The answer is D. Erector spinae. Explanation. Positive rest position helps correct forward head posture and lordosis, both postural imbalances that cause the erector spinae muscles running alongside the spine to contract. It is difficult to stretch the quadratus lumborum, but lying in a supine position with bent knees and placing a tennis ball beneath the QL can provide some relief. Bridges and low lunges with the posterior knee bent on the floor both stretch the hip flexors effectively. Reaching for one's toes, either while standing or sitting with the legs outstretched, is the classic antidote to tight hamstrings. Number 9. Wall angels can help with which of the following? A. Relieve pain in the rhomboids. B. Correct medial rotation of the shoulders. C. Relieve pain in the rhomboids, correct medial rotation of the shoulders, and stretch the pectoral muscles. D. Stretch the pectoral muscles. The answer is C. Relieve pain in the rhomboids, correct medial rotation of the shoulders, and stretch the pectoral muscles. Explanation. Wall angels alleviate medial rotation of the shoulders, stretching contracted pectoral muscles, and strengthening the rhomboid muscles between the shoulder blades. Number 10. A weak gluteus medius and tight bands can result in which of the following conditions? A. Tension headaches. B. Swayback. C. Patellar instability. D. TMJ. The answer is C. Patellar instability. Explanation. The gluteus medius plays an important role in stabilizing the pelvis while walking. When this muscle is weak, the IT bands, long sheaths of connective tissue on the outer thigh, may compensate, creating lateral force on the knee joint and pulling the patella outward. Thanks for watching. Don't forget to like, share and subscribe to our channel for updated videos every week.